Hey, we all know someone who has waited for a miracle. In India, hundreds of thousands of people are waiting for an organ transplant. Every day, about 20 people die just waiting. It's a long, painful wait for a matching donor. But what if we didn't have to wait? What if we could take a patient's own cells and print them a new organ? Just like you print a document. Sounds like sci-fi movie, right? But this is real. It's happening right now. And it's called bioprinting. For anyone interested in the future of technology and health, this is a story you need to hear. So let's begin. What is bioprinting? It's simpler than you think. Forget all complicated science for a moment. Imagine building something with Legos, but instead of plastic blocks, you are using tiny clusters of living human cells, and instead of your hands, you are using a super precise 3D printer. The printer deposits these cells mixed in a special gel layer by layer to build a 3D structure. This special gel is called a bioink. Think of it like a special bond or glue that holds the cell together and keeps them alive. The goal is to create living tissue like skin, bone, and one day even entire organs, like a liver or kidney. For a long time, printing soft living parts was very difficult. But now, scientists have made some amazing progress. The first big step is the bioink itself. Old bioinks were often weak and would break easily. But now, new types of gels have been created that are soft and stretchy, just like our real body tissue. Imagine printing a blood vessels that can stretch and bend. This is a huge step towards printing complex organs. Printing an organ with single cell would take days and the cells might die. But now, scientists are printing with small group of cells like tiny balls. This makes the process much faster and keeps the cell healthy. This could one day lead to bedside bioprinting, where a doctor could print new tissue directly onto a wound during surgery to help it heal faster. And the best part, India is not just watching from the sidelines, we are a part of this global revolution. Our top institutes are leading the charge. The Indian Institute of Science IISC in Bengaluru has opened a center of excellence for 3D bioprinting. They are doing amazing research on printing tissues for the heart, bone, cancer, and cartilage. IISC is working to develop new medical technologies that make healthcare more affordable to everyone. And it's not just our top institutes, Indian startups are also making a mark. A company called Ave Biosciences, co-founded by an IIT Madras alumnus, has developed its own advanced 3D bioprinter right here in India, with some manufacturing in Chennai and Bengaluru. Their first printer was installed at IISC. Kolkata-based AlphaTech System has installed its bioprinters in many top Indian institutes like IITS and AIIMS. These companies are developing everything from the hardware to the software, creating a made in India ecosystem for futuristic technology. What does this mean for you and for investors? So why should we be excited? For patients, this technology offers hope. It could mean an end to the long waiting list of organs. And because the organ would be printed from your own cells, the risk of your body rejecting the new organ would be much lower. For investors and people who love technology, this is a massive opportunity. The global 3D bioprinting market is expected to be worth billions of dollars. Indian companies and researchers are perfectly placed to be leaders in this field. The focus isn't just on printing organs, but also on new materials, creating the next generation of bioinks. Printers and softwares, building the machines that will power this revolution. Drug testings, using printed tissue to test new medicines safely and effectively. The road ahead, what are the challenges? Now let's be realistic. We won't be printing a full heart for transplant tomorrow. There are still big challenges. The biggest challenge is creating the network of blood vessels, the tiny pipes that carry blood and nutrients deep inside an organ. Scientists are working hard on this. Getting regulatory approval and doing clinical trials will also take time. We will likely see simpler printed tissues like skin for burn victims or cartilage for joint repair in hospitals in next 5 to 10 years. Printing complex solid organs is still probably 15 to 20 years away. Bioprinting is one of the most exciting fields in science today. It's a story of hope, innovation, and a healthier future for all of us. From the amazing labs at IISc to the brilliant minds in our startups, India is writing its own chapter in this story. This technology could change healthcare forever, making it more personal, effective, and accessible. What do you think about bioprinting? Are you excited about this technology? Let me know your thoughts in the comments below, and if you enjoyed this video, want to know more about how technology is shaping our future, don't forget to like, share and subscribe. Thanks for watching.